Hi, everyone. Welcome. Thank you so much for joining us today. We're going to be talking about how to train your pregnant clients like a pro. And as Brittany mentioned, this is going to be a little bit of a taste or an introduction to our approach to doing that. And hopefully you will take away some philosophical understandings, but also practical tools that you can use with this population, but in fact will benefit all of your clients. So let's get started and talk about what we're going to be covering today. We're going to briefly go over the evolution of prenatal exercise guidance, where we've come from and where we are, and some of the really powerful research-backed benefits that we can gain. We're going to talk about the limitation of a standard approach to prenatal training and introduce you to the ProNatal fitness performance training approach and talk about why we believe that is a more effective approach. And then we're going to get into the core activation mini lesson. And these are tools that you can use for all of your clients, regardless of their age or stage or even gender. And then as Brittany mentioned, we're going to be going over the pre and postnatal fitness specialist certification overview, giving you some high level information as well as some more details about that sale. So at the end of this presentation, you'll be able to appreciate why the standard prenatal exercise approach can leave the body less well prepared to manage the stresses of pregnancy. You'll understand what it means to utilize a performance training approach and why we believe it is the most effective approach for this population. And know the critical role that core training plays and how to teach all of your clients to activate their deep core more effectively. So if we talk about the evolution of prenatal exercise guidance, we're really looking back at a time when there was a lot of fear consuming the minds of people who gave this advice out to those who are pregnant. And what I mean by that is the thought that we should minimize stress because pregnancy was almost considered a condition. And so those who went through this process were taught to minimize their exertion levels, stay low stress, don't exert themselves very much. Thankfully, though, in the 1980s, research started being done on this population and found terrific benefits coming from moderate intensity activity. Some of these benefits to the parent include reducing the risk of gestational diabetes, hypertension, preeclampsia, and other pregnancy-induced medical complications. Staying more active helps to prevent pains and injuries that often accompany this stage. It also can reduce things like nausea, heartburn, constipation, swelling, varicose veins, hemorrhoids, and all of the other joyful things that occur during this time. There are many more, but we will just stick to this brief list. Exercise, though, will also improve things like energy, mood, sleep quality, these very important factors. And these benefits carry over into labor as well. So it increases stamina and pushing effectiveness. It reduces the use of medical interventions. It actually speeds up the actual time of labor itself. And we also now see many benefits to baby. So those born to those who have exercised more during pregnancy have better outcomes for the baby, including things like placental function and overall health at birth. Birth weight is in a healthier range, and it helps to reduce the risk of obesity later on. Being more active for the parent during pregnancy actually gets the baby ready to handle the stresses of labor easier. So spikes in heart rate that come with contractions are not as negatively impacting on the baby because the baby is used to these spikes, these up and down up and down spikes of heart rate during pregnancy exercise. So baby is experiencing these highs and lows and not getting as stressed because of it, because it's a condition that has been experiencing over time. We also see that cardiorespiratory health for the baby into childhood and beyond is better. And this is newer research that is just starting to enter into our world here, learning that not only do we get physical benefits, but we also get cognitive benefits. So those children who are taking language and intelligence tests have shown higher scores if they were born to somebody who was more active during pregnancy. So all of this lets us know that the 9 months of pregnancy can have a lifetime impact on the next generation and even beyond. So it's incumbent upon us to try to give these clients at this stage of life the best preparation possible. Now, in terms of exercise guidance during pregnancy, in the United States, we look to ACOG, or the American College of Obstetricians and Gynecologists, as the leading body putting forth these recommendations. And what they say is that everyone who is pregnant should engage in aerobic and strength training before, during, and after pregnancy. They recommend about 20 to 30 minutes of moderate intensity activities most, if not all, days of the week. And here you can see a list of safe recommendations when it comes to different forms of exercise. So many of them are of the aerobic nature, so walking, cycling, dancing, things like that. They do put resistance exercises and stretching in there, but we're going to come back to this list momentarily. So overall, what you're seeing is that ACOG is saying absolutely it's important and beneficial to stay active, but the recommendations are typically in the more generalized fitness category. However, we have to acknowledge that the pregnancy journey is very high stress and demanding. So all of the months of changes to different systems in the body, from alignment and weight gain to center of gravity shifts, musculoskeletal changes, the body is undergoing a lot of change and a lot of stress during pregnancy. Then we have the actual nature of childbirth, which in and of itself can be very, very stressful. It can last for hours, stretching to days. And of course, depending on the nature of the type of labor that is experienced, it can really exhaust that person going through it. And then when all of that's over, when we could use a nice beach vacation, we have to dive into the 24/7 demands of parenthood. So we get no rest. The body, which has already been taxed for many, many months, has to be able to perform these movements. And we're trying to do all this with minimal stress to the body. And that's where I'll talk about our approach and why we believe specifics training is most important for this population. So if we acknowledge that the pregnancy journey is high stress, we have to think about how do other performers prepare for specific high stress events. Maybe we can take a page from their book. So if we, in this example, use someone training for a marathon, how would one prepare for something like this? Well, the first step would be to define the goals that they're training for. So we know that a marathon is 26.2 miles. In fact, I was just in New York on Sunday cheering on the New York City marathoners, and it really is a tremendous feat. But we first have to start by understanding what is involved. So we have to define the goals first. The second step is to assess the demands of those goals. So just because we know the duration of this race, we need to understand the specific factors that go into its execution. So how does the body have to prepare? We know that it is in a particular plane of motion. We know that the biomechanics and the energetics involved in order to run, right? We break down the goals into their component parts to know how to prepare the body. Then we need to organize some sort of a training plan so we know how to get from our starting to our ending point. And if you were to do a quick Google search about how to train for a marathon, you would see millions of results talking about training plans to get the body ready. So these resources are widely available. And you would want to use a plan in order to prepare for something so stressful. And then the final step for this process would be to assess one's starting point. So it's very different for someone who can barely run a mile to prepare them to achieve a marathon distance versus someone who's already routinely running 10 miles. So we go through these 4 steps in order to prepare the body adequately for the specific demands of this type of event. Winging it is not a widely adopted strategy. So I think we can all agree that something like a marathon requires specific preparation. Now let's compare that to how the standard prenatal approach tends to unfold when one is preparing for birth. If we take these same steps, does one define the goals they're training for? Well, we don't often talk about childbirth, especially in this culture. So it's very hard to know exactly what we're preparing for. It's a big unknown void out there. And so it's very hard to give specific and definitive goals. And we certainly cannot assess the demands of goals that we are not defining. So we don't know how to prepare for something if we haven't named it and classified it. The third step of organizing a training plan is something that we do tend to engage in, and we want to seek out information and how to plan for it. But if we were to search the same terms that we did for the marathon as for how to train during pregnancy, what you will see is lots of results, but most of them are centered around what kinds of activities are safe during pregnancy. So it's a very different mindset to create a plan for something and then get your body ready for it versus saying, okay, stick to what's safe, let's modify, let's figure out how to keep you from hurting yourself. You can hear in the language, it's a very, very different approach. So most people stick with safe. And I can say that most people do not assess their starting point. So they don't really know their physical capacities at the beginning of pregnancy to think about how to get them towards those end goals, those undefinable end goals. So this standard prenatal approach is essentially where we tend to reduce loads, we stick to what's safe, it's more generalized fitness. But does something like this form of exercise really truly prepare the body for these stresses? And I would argue no. And the main thing that we have to keep in mind has to do with the strength to weight ratio. And I'm going to talk about why this gets altered during pregnancy when we take a standard approach. So what I'm about to show you is a graph, and it's representative of weight gain throughout pregnancy as well as strength levels. And I don't want you to get tied up in the specific numbers here. I just want you to take a look at the trends because that's what's most important to keep in mind. So in this graph here, you can see the top line, the pink line is going to be representative of one's weight at the beginning of pregnancy on the left. So the first month of pregnancy, starting at about 140 pounds. And then we're going to work our way up to about 178 pounds. So this is close to a standard weight gain, about 38 to 40 pounds. Not what's recommended, but what is standard. We actually have lower recommendations for a single pregnancy. But this is what's most typical that we're going to see. So this weight gain increases throughout pregnancy over the 9 months. That's obviously what's going to happen. Now, let's take a look at the blue line. The blue line is representing a hypothetical strength number. So let's just say that this person at the beginning of pregnancy or pre-pregnancy was able to squat with 80 pounds. If they were to take that very safe approach where they're sticking to mostly small weights or body weight, generalized activity, and they stop lifting those heavier loads, over the course of the 9 months, their strength levels are going to decline. And what that sets us up for is to be at our heaviest when we're at our weakest, if we are not focusing on strength. So in favor of this standard prenatal approach, we're arguing for what we call our performance training approach. And what this means is that we believe training for pregnancy is like training for any other major athletic event. And we have to prioritize specificity. So with this performance training approach, we're going to be checking off the boxes on all 4 of these steps. And for the purposes of today, I want to focus in on the first step, which is to define the goals that all of our clients are training for. But have you ever considered this question? What are your pregnant clients actually training for? So what we were going to do is break down what we believe to be the 3 important goals that are all interrelated yet separate. The first one is to train for pregnancy so that one is more successful at being pregnant. And what I mean by that is for clients to be able to minimize their pain and potential of developing pain, as well as maximizing their day-to-day function so that they can finish the day and finish their pregnancy with energy and vitality, so that perhaps they can enjoy this period rather than simply enduring it and making to the end. The second goal is to train for childbirth, and that's to help make the process smoother and easier for both the parent and the baby. As I said in the beginning, there are a host of benefits for those who exercise, so we want to make sure that they are as well prepared as possible to have the best outcomes. And then finally, we're also training for parenthood. Now, when we talk about parenthood, it's the part that comes after childbirth, but we're going to break that down into 3 smaller sub goals. So the first goal is to be able to recover more quickly from childbirth, be able to perform ADLs or activities of daily living more effectively. And then eventually the longer term goal is to have clients return to their favorite activities or perhaps start new ones. So we want to get their bodies not only recovered, but back to higher performance. Now, if we were to get into the second component of our performance training approach, which is to assess the demands, you can see that each of these 3 goals we break down into smaller parts to understand the demands being placed on the body. Now, I'm not going to get into all of these today, but just recognize that there are a lot of elements to consider when building your prenatal programming. And if we do it right and we address all these elements, they all get taken care of during the prenatal program. So you are training your clients for all 3 of those goals during the prenatal period. Now, step 3 is organize the training plan. And I want to introduce you to our 3-stage prenatal programming framework. Essentially what this is a very flexible framework that we take all of our pregnant clients through, and we always start at the bottom of the pyramid, which is our foundation stage. So regardless of stage of pregnancy, age, fitness level, prior experience, everyone starts in foundation stage. And in order to move on, they have to master all of the objectives to the right, as you see, of the foundation stage. So we want to teach all of our clients how to be in good neutral alignment. We're going to teach them how to do core activation drills. We're going to teach them fundamental movement patterns, as well as the parenthood ADLs. So how do we move with a load in a safe and efficient way? Now, once clients have mastered those 4 objectives, then they can move on to the strength stage. And in the strength stage, that's really where we start prioritizing the intensity and the loads. So we increase intensity as well as core capacity. And then we prepare our clients with a form of interval training called LIT. It's called labor intensity interval training. And this is a way of very specifically training the physical and mental aspects in preparation for childbirth. So how to handle the stress and recovery cycles of contractions. This is very specific work that we do with them, getting them ready for the big day as it comes closer and closer. And then the final stage that we have is our birth prep stage. And most clients are going to go into this at around the 7th month of pregnancy. And we have 3 objectives to teach them there. We are going to teach them specific mental preparation techniques, pushing practice, or how to push effectively, which, as you'll be potentially surprised to know, is not something that comes naturally. So without getting into great detail, the way that we think we need to push is not, in fact, how the body wants to fall back to when we are in a more medicalized environment. So the more we can practice leading up to the big day, the more we can train that motor pattern, it's going to be there for us when we need it. And then finally, we teach our clients postpartum recovery education. So they'll be able to be more proactive in the early days of their recovery, getting their deep core system back online. So that's a brief overview of how we take all of the information of breaking down the goals into the component parts, and we build it into this very flexible 3-stage framework. And then the last piece here of the 4 steps of our performance training approach is to assess the client's starting point. And again, beyond our work today, I will just say that we have a very specific movement assessment protocol that we take all of our clients through to see how they move with real world tasks. So it's really important that we take away just the standard gym language of how we refer to movements, because we want to access their movement patterns in the outside world. That's the way we can have greatest influence over them, rather than just the hour or 2 or 3 that they're with us throughout the week. Now, I want to go back into our triangle and really highlight here in the foundation stage the core activation piece, because we're going to be getting into the mini lesson now that you have seen the big picture. So when we talk about core activation, we're really saying that you can have the most significant improvement on your client's health and baby's health if we can teach our clients how to use their deep cores most effectively. And if we optimize our clients' deep core function, then they receive a whole host of benefits. For those who are pregnant, they experience fewer pains and injuries. We can improve the fetal development process if we are breathing and utilizing this core well. The labors become easier. We learn how to push and use our breath to be more productive with our pushing. So it's a smoother process with fewer interventions. And there's also a quicker postpartum recovery when we know how to utilize this deep core system. And then for all of your clients, they get benefits that go well beyond what I've listed here. This is just a few. Because when we breathe with optimal functioning, we are impacting the central nervous system. So we get systemic change in the body. So we can impact our stress levels by reducing them based on the way that we breathe. We improve our immune system function. We improve digestion and recovery. And we move better when we know how to utilize this deep core system. So when I'm talking about the deep core, I'm really referring to a structure called the core canister. And here's a visual of what these structures are. And I'm going to use my water bottle as a canister to highlight these 3 structures. So on the top of the canister, this is going to be the diaphragm. And this sits just under your rib cage here. The bottom of the core canister is the pelvic floor, and that sits in your pelvis. It is sort of like a bowl, and there are several layers of muscles in here that span from front to back, the pubic bone to the base of the tailbone, and then from side to side your sits bones or your ischial tuberosities. So it covers the whole span at the bottom. And then the wall here of the can is going to be your transverse abdominis muscle, and this is your deepest, most core layer. So you may have a sense of these individual structures, but really what we want to do is integrate them, because the greatest benefit comes when the core canister muscles work together as a unit. And we're going to be doing that now with our 360 breathing. So let's talk about breathing and how to perform it. As I mentioned earlier, if we're breathing well and utilizing this core canister system well, we gain a tremendous amount of benefits. And this is especially important for our pregnant clients, and I'll explain why in just a moment. But let's first learn how to breathe most efficiently. So if you'd like to join me, I welcome you to sit up tall or stand up tall. And we're going to take our hands and create this L shape, and we're going to place them around the lower rib cage. So the thumbs will be at the back of the rib cage, and your fingertips are coming around more towards the front of the rib cage. So what we're going to do in that position is first inhale. We're going to be inhaling through the nose and expanding the rib cage in 360 degrees. I want you to try to do this in your own time, inhaling through the nose, trying to push into all parts of your L around the rib cage. So you could do that a few times, and I'll talk while you do this. As you are inhaling, we tend to be really good at sending air forward into the fingertips. What we tend to need more work on is expanding into the sides and back of the rib cage. So as you inhale, try to laterally expand and posteriorly expand into those thumbs. We tend to have blind spots there, and many clients often can get good feedback by using these L's as they breathe to feel where that expansion is happening. The other part that we have to keep in mind is what's going on up here. Because a lot of times for people who are in a more sympathetic or stressed state, they tend to inhale by raising up the shoulders. And then they have a bunch of accessory neck muscle recruitment, which the neck is not designed as a respiratory system, right? But the body wants to get air in however it can. We're just trying to make it a more efficient and healthy process. So when you are inhaling, you want to try to keep the shoulders still and the neck quiet. And that's how you'll know the expansion is happening lower down in the rib cage. Now let's talk about the exhale. So once you've inhaled this system and it's got all this air, we want to get it out. And when we expire, we want to blow the air through pursed lips until no air is left. So we want to feel that sense of contraction coming together in 3 dimensions. And as you exhale, the longer you exhale, the more you're going to feel your belly and the tautness in the front of the core. So let's try this together now. We're going to inhale through the nose, expand 360. Now we're going to exhale. Until no air is left. So if you do that a few times, you're really ramping up activation of that deep core system. The other benefit of exhaling fully is that we can then prime a more robust inhale on the next breath cycle. So one exhale feeds the next inhale. Every inhale feeds the next exhale. So they work together. Now, this is very beneficial for all of your clients, but with specific attention to your prenatal clients because it's going to help them regulate intra-abdominal pressure, or IAP. Now, what the heck is this big term that I'm using? Well, intra-abdominal pressure essentially means the amount of pressure that's in the abdominal cavity at any one time. We need intra-abdominal pressure to help protect the spine during exertion. So this canister, if you will use the analogy of this water bottle, imagine I had a straw going through it, right? The straw is your spine, and the canister is the muscular system that has pressure inside of it. So it's keeping that straw safe and protected as we're moving and lifting and bending. Intra-abdominal pressure is another way that we can help transfer forces through the core from the extremities. So for example, if I'm doing a deadlift and I'm picking up a load, my feet are pushing into the ground, and then the forces are going through my legs, through my core, through my shoulders and arms to my hands to help me lift. If I have enough pressure in my cavity, in my abdominal cavity, my spine will stay protected and I'll be able to transfer those forces more efficiently. So we want and need intra-abdominal pressure. However, prolonged elevated intra-abdominal pressure can have negative effects for the prenatal population. So during pregnancy, the belly is expanding and growing with the development of baby and all the fluids as the uterus is expanding. We are having this increase in mass in the abdominal cavity, and that is increasing intra-abdominal pressure. This is also encouraging some alignment shifts, especially towards an anterior pelvic tilt. And what this is going to do is put excessive pressure and stress on the abdominal wall and also down on the pelvic floor. This can increase the potential for something called diastasis recti. Now, diastasis or DR or diastasis, however you want to say it, DR is essentially the body's way of adapting and growing and stretching to accommodate the growing baby. And if you have your rectus abdominis muscles, those six-pack muscles coming down the front side of the belly, those are naturally going to start to expand and widen. And that means that now we have this midline tissue, which is getting more pressure placed on it because of this intra-abdominal pressure elevation. So diastasis, while still being a very natural part of pregnancy, is not something that we want to add more pressure to. Likewise, the downward pressure on the pelvic floor can set clients up potentially for things like incontinence. So if you have clients who have to go to the bathroom before they do any jumping or skipping rope, or maybe they have to stop in the middle of a run to go to the bathroom, those are all signs that that pelvic floor is out of balance. And so what we want to try to do with the breath is manage intra-abdominal pressure to minimize the severity of these issues that can crop up during pregnancy. So it's very important that we establish a firm foundation of this 360 breath, and then we're going to teach clients how to incorporate this breath into movement. And there are three elements that I want you to keep in mind when you're integrating 360 breathing. We're going to exhale on the effort. We want to have our clients matching the amount of tension they produce to the task at hand. And then we want to make sure we are avoiding chronic core engagement. So I just want to get into these three in depth a little bit more. So when we are exhaling, we want to make sure that we're coordinating the exhale with the specific phase in the movement that's more difficult or greater exertion. So we're going to inhale on the easier portion of a movement, and then we're going to exhale on the more challenging portion. So for example, in a squat, we would inhale on the way down, exhale on the way up. This is going to help prevent intra-abdominal pressure from elevating more than necessary. So I'm going to show you a brief example. This is one of our team members, our former team members, Claire, when she was pregnant, and she's going to be performing a single arm band row. If you can hear it and also watch for it, she's going to exhale just before the pull, because the pulling part is the more difficult movement. Good. So you really see the exhale is bringing that belly button in. And this really helps us to get the desired effect without cueing core engagement. And I'll talk in a minute why we want to change some of the language we use with our clients when it comes to how to engage their core, because it can actually result in decreased activation if we cue them inappropriately. So she is exhaling, and that is drawing the belly in as a result. Now, the second part that we want to keep in mind is matching tension to task. So in general, the greater the intensity or stability challenge of a movement, we're going to require a stronger exhale. So here we see Brittany is picking up a water bottle. We don't need a maximal exhale for this, right? This is a very simple task, so we can get away with just comfortable breathing here. Now, this person who's about to lift a very heavy load is going to require a much more robust exhale to help reduce that intra-abdominal pressure spike. Likewise, here you can see I'm doing a single arm tall kneeling chest press. There's a lot of complexity and reduced base of support here, so I'm going to require a stronger exhale as I'm pressing. Now, the final element to keep in mind when your clients are breathing during movement is to help them avoid chronically engaging their core. And this is the part that may challenge your thinking a little bit. And I hope that's something that you're going to take away as a positive, to reconsider things that you may believe to be a truism. So we tend to think that more activation is beneficial, especially when it comes to the core. So what we tend to do is give cues like suck in the belly, tighten those abs, keep it, hold it tight, right? In an attempt to try to increase activation. But I'm going to show you, hopefully, in the next couple of slides, why that's actually doing the opposite. So we're going to take the core canister from a water bottle to a balloon. It's the same principle where we have this structure with air inside of it, which is going to represent the intra-abdominal pressure. So there is enough pressure in it to keep the balloon in this robust shape. Now, when we use some of these cues, like pull the belly in towards the spine, what we're essentially doing is squeezing the middle of this balloon. We're keeping the belly taut, right? Now, the pressure has to go somewhere. It will travel up and it will travel down, just like you see in this example. So when the pressure increases upwards, it's going to restrict lung expansion. So the lungs that are in the thoracic cavity can't fully descend and open on the inhale. Same with the diaphragm. It's right below the lungs. It wants to be able to move down to get in that inhale, but it's getting a little bit stuck because of this pressure moving upward. What happens then if we can't fully descend and expand in the rib cage? Well, we go back to that pattern of breathing, which is called apical breathing, the one I mentioned earlier, where you have the shoulders rising instead of the ribs expanding. And that triggers the brain into a sympathetic or stressed state, and that does not have good long-term implications for us. So we don't want to live there. The pressure then also travels downward, and that increases the risk of pelvic floor dysfunction. Finally, by keeping the core tight more than we need it to be, given the activity and the demands that we're placing on it, it will actually decrease core activation. And that is because when we keep the core taut and we're not able to fully expand on the inhale, we are not going to be able to have a robust exhale, which is the part that you felt that deep core really getting taut in the front of the belly. If we can't properly inhale and expand because of this excess tension, we cannot properly exhale and contract that deep core system. So rather than telling your clients to suck the belly in or hold the tension in, just let it go. Okay, allow them to be a fully moving system that responds to each task rather than keeping rigid all the time when it's not necessary. So coming back to our 3-stage programming framework, what we just did was we went over the foundation stage objective of core activation. Now, we talked about 360 breathing. Just keep in mind that in our full-length course, we go over pelvic floor work as well with techniques that are called pelvic floor activations. And we're a little bit too crunched for time today to get into that, but just know that we do address the pelvic floor very specifically, because for our prenatal clients, we need to be strong in the pelvic floor, but we also need to be able to lengthen and get long for delivery. So we get into all of that in the course. And that was the little highlight we wanted to give you today. And hopefully you feel comfortable and understand and feel how the core can function in an optimal way when we utilize 360 breathing. And I just wanted to point your attention, we cover postpartum programming in a very similar method that we do as prenatal. So you can see here that we have a 3-stage programming structure, and each stage has its own objectives. The big change comes in the foundation stage, so that rather than working core activation, now we're getting into the details of a very specific core recovery protocol to help your clients heal and build that strength and motor connection from the inside out, so that they can perform their daily tasks and then eventually get ready for those higher performance activities they want to get back to.
So I hope you found that helpful. And what we were trying to do in this presentation is we kind of want to give you the big picture overview of our approach, but we wanted to make sure you came away with some tools you can immediately apply. And so I hope you feel that this 360 breathing, we actually refer it as the #1 most effective core exercise for any human being. Because as Carolyn mentioned, the way you breathe impacts every single system in your body. So this is an exercise that's incredibly important for the pre and postnatal population, especially because of its role in managing intra-abdominal pressure and everything, but it is so beneficial for all of your clients. So we always recommend it being the first move you teach them how to perform 360 breathing, and then teach them how to incorporate it into movement through those things like exhaling on the effort and those cues that we talked through. So that's kind of, we wanted to give you a little big picture, but then also making sure you have some tangible tools. So that's just one of the things you learn in the specialist course. I'm going to go over a little bit about the course now, if this is an approach that intrigued you, and the special we have coming up in Black Friday. So we are pleased that this certification is now the #1 recommended pre and postnatal certification by the leading clubs, health clubs, and boutique studios in the US, many of which you see pictured here. So before I get into actually what you learn in the course, this is just kind of what you receive with your enrollment. So this certification it's all self-paced online. So there are 17 learning modules. You progress through at your own pace. It's about 30 to 35 hours, but that really varies widely by individual. You have 1 year access to complete the course and take the exam, but the materials are available for you to download. So you have access to those for life. Each module has both a video lesson of Carolyn taking you through the material and a downloadable PDF to accommodate those different learning preferences. We also have a full course electronic textbook of all the PDFs together, so you can save, you can print, whatever you want. There are also self-checks along the way. Each module has a self-check, so you can make sure you're understanding the most important information, and you get plenty of case study practice, actually designing programs for different types of clients. You get programming templates and sample workouts, and we make it really easy for you with a video exercise library of over 130 exercises. You also get editable intake forms, movement assessment checklists, and we've created some really valuable handouts for your clients. So we worked with a registered dietitian to prepare a robust pregnancy nutrition guide, and we worked with a childbirth education company to prepare a birth preparation guide. So just valuable resources to share with your clients. Upon completing the exam, you'll earn your certificate as a pre- and postnatal fitness specialist, and a lot of CEUs, as you see pictured here. And if you don't see your organization, there's usually an easy petition process. Now I want to cover some of the key themes you'll learn in the course. I am not going to go through the detail of all 17 modules because we do not have that kind of time, but we do have a full course outline on the course page, which I'll share with you at the end. But just some of the key themes you will learn. One of the big ones is just program design. And I think this is what a lot of course graduates would say really sets this course apart from others, is just a level of detail and program design you get. So you will get detailed prenatal and postpartum programming guidance. And not only these high-level frameworks that Carolyn kind of briefly took you through, but we will take you then through how to actually progress the client through these frameworks depending on their stage when starting, their fitness level, and several other factors. So you will learn how to design that big picture training program for your clients, how to break that down into smaller skill-based learning stages, and then how to design the individual session, how to select movements, and how to make sure you're having enough consistency with movements so that your clients build competency, but also building in enough variability so they stay engaged. So we give you all of that information. You, of course, get your sample workouts, your programming templates. You get to do some case study practice with us. And then you have that video exercise library to make it really easy to plug and play into your templates. And of course, you get the guidance on what to avoid and regress by trimester, so you know what not to focus on as well. The other big bucket that you learn is the assessment process, which Carolyn briefly mentioned earlier. So we have a 3-step assessment process we'll take you through. You learn the whole process. You get editable intake forms that you see pictured here. And you also learn that unique movement assessment process, which is designed to give you greater insight into how your clients move in real life. So you get that more accurate information. So this can be great to kind of add in to what you might already do with your clients. And then you will get a movement assessment checklist, both in person and virtual, because we do the assessments a little bit differently in virtual to make sure it's as efficient as possible. The other thing you will learn is pains and injuries. So unfortunately, there are many common pains and injuries during pregnancy. We will dive into 8 of the most common, including the 4 you see pictured here from left to right: low back pain, diastasis recti, SI joint pain, and pelvic floor dysfunction. For each of them, you'll understand the symptoms and how to spot them. You'll also understand their causes, both pregnancy related and non-pregnancy related, because you will see how all of these pains and injuries are not exclusive to the pre and postnatal population. And this is often a very eye-opening module for people as they see, oh, this can occur in my male clients, in my athletes, and you go back and you realize, oh, that could be what this client's issue is. So we teach you how to prevent a lot of these things in the first place and how to address them if you happen to be working with a client who's experiencing one. And then you'll learn some global strategies to prevent most issues in the first place. A big piece of the postpartum section will be taking you through our recovery protocol. So as Carolyn mentioned, diastasis recti, you will learn how to perform this assessment in detail to get the most accurate results. Diastasis recti, you can see kind of pictured here. It is a widening of the gap between the left and the right sides of the rectus abdominis muscle. You can kind of see it pictured here. It may also present as this torpedo-like coning down the center of the abdomen. So there are many causes for DR. Anyone can get it, male or female. But as Carolyn mentioned earlier, one completely normal, necessary, natural cause is pregnancy. It's needed for the body to adapt to carry a growing baby and for that baby to exit. So that means everyone is going to have a little bit of DR in the immediate aftermath of labor. And the healing rates vary widely by individual. So it's really important to be able to know how to perform this diastasis recti assessment on postpartum clients, because their degree of DR is going to greatly influence the training you take them through. So you will learn how to do that, and you will learn how to take them through the very detailed core recovery protocol. So this is a 3-phase protocol that we teach you in the course. It's great for healing from DR, healing from a C-section, and it's just a wonderful methodology to rebuild the core from the inside out. But we don't want our clients to stay in recovery. We want them getting back to the activities they love and more. So you will learn how to safely build your client's strength, especially their core strength. You will learn a step-by-step process for getting them back to impact and higher intensity activity. And then you'll learn how to prepare your clients for life with a 2-year-old. Or a toddler. So by the way, the average 2-year-old is 25 to 30 pounds. By this time, many of your clients may have another little one on the way, which just adds a whole nother layer of fun. So this is really important to be able to prepare your clients for this period as well. And then finally, you learn strategies to just be the best coach for your clients. We worked with multiple women's health psychotherapists in this course. And so you will learn strategies, you will learn understanding how to manage various pre and postnatal psychological changes and considerations that can occur. No two pregnancies are the same, but there are some common themes and challenges to be aware of and kind of how to manage those things. You will also understand PMADs, perinatal mood and anxiety disorders. Postpartum depression is just one example, but there are many and they can occur anytime during pregnancy or postpartum. So you will learn how to spot them and how to support any clients who might be experiencing them. And then finally, you will just learn how to be the best coach for your clients as they navigate this incredible but very complex journey. So those are some of the key themes that you'll learn in the course. Again, you can download the full course outline on the course page. The last thing I want to share with you is another unique benefit that we offer, and that is to join the ProNatal Certified Network. So this is an optional annual membership that you can join. It is available for course enrollees, and it gives you resources and support to basically help you in your business grow. So you can enroll anytime after enrolling in the course. But if you join the membership, when you enroll in the course, you can save on your first year. So I will cover that, but just some of the benefits of the ProNatal Certified Network. You get featured endorsement on our very heavily trafficked Find a Coach page of our website. So keywords related to personal trainer for pregnancy are the #1 driver of traffic to our homepage. So we have tons of clients visiting this directory to find a ProNatal certified coach near them. So we leave this is only for our PCN members. You also get a private support community. You get access to our full exercise library and workout builder. So this has over 200 exercises and the ability to create workouts using our filtering criteria, like show me all the core exercises for a pregnant client in her second trimester with no equipment. And you can build workouts using this. You can send them to your clients, or you can copy them into your Everfit software easily as well. And then just like you're doing here, we also host our own live webinars regularly. We bring in outside experts because we want to make sure that our PCN members continue to learn and grow and develop their skills in this space and really be the best coach for their clients. You also get access to all of our course updates. By the way, our specialist course, all of our courses are updated every 1 to 2 years to reflect new research and participant feedback. The specialist course we just did a major upgrade in 2024. So this is all new stuff. All of the materials have been updated. And then exclusive discounts on ProNatal offerings and other products. So that's just some of the benefits of joining the ProNatal Certified Network. Again, it's optional. It's $150 per year. You can cancel any time, but if you join when you enroll in your course, you're going to save on your first year. So this is the 2024 pricing, not the Black Friday special, but the course is currently $699. And then if you enroll in the ProNatal Certified Network, that's just $100 more. So you're saving on the first year. This pricing will be going up in 2025 to reflect the major upgrade that we just did this year without taking price. So before we do that, we're having our biggest sale of the year, November 25th to December 2nd, where you can get $150 off the course and $200 off the ProNatal Certified package. So getting that full package with all the ProNatal Certified benefits for $100 less than the course only would normally be priced. So that will be November 25th to December 2nd. We will also be having a 0% interest payment plan. It comes with a money back guarantee. This is the QR code for you to check out the course page to get more information. And I think we're sending a follow-up email where you can download some of our resources. And by doing that, you will get into our email list. So you will be notified of the sale if you are interested. So that is all that I have. Now I'm going to stop sharing so I can see the screen.
Yeah, thank you so much for this. This was amazing. I took a lot of notes and got a lot of insight out of it. So I'm sure everybody else in the chat did as well. So yeah, keep an eye out for that email. It'll have links to ProNatal, it'll have the link to the recording, and then it'll also have a link to give feedback on the survey as well. So we always encourage you to give feedback to us, and that way it'll help Everfit Academy make sure that we're delivering content that's relevant to you. So yeah, just want to say thank you again. Brittany and Carolyn for coming on today. And yeah, looking forward to working with you more in the future and delivering even more content for Everfit Academy. And with that, I'll just say thank you, everybody. Enjoy the rest of your day.
Thanks so much.
We'll get out of here.